it was an opportunity for us to also showcase an initiative, bring to the fore a very important initiative that we have initiated called Accord for a Healthier World, because we believe that where you live should not affect, your the quality of healthcare you receive, and the your income also should not determine the health outcomes that a patient gets. Unfortunately, there are still gaps in, and so we felt this is an important forum to partner with breast cancer being a significant problem in Ghana and across the world. We believe that where you live should not affect the quality of your health, the healthcare you receive, as well as the income. Your income should not affect the health outcomes, right? And yes, primary healthcare is very important. However, these gaps still exist. And that is one of the reasons why Pfizer decided to launch the Accord for a Healthier World, which aims in its entirety to close that gap, that health equity gap that you just referred to, and which we know exists globally. So the intention is to make our medicines, our vaccines, available at not-for-profit price to 1.2 billion people, over 1.2 billion people living in low-income countries, right? So, yes, that is one of the ways that we are contributing to close this equity gap. And so, yes, we are committed to providing the full portfolio of our medicines and vaccines that we own global right to, right? At a not-for-profit prices to 45 low-income countries across the world. However, that is one step in closing this health equity gap. As you rightly noted, there are other steps involved, and we are collaborating with the country governments and country authorities to enhance, operational systems that will strengthen the health systems itself through what we refer to as access enablers. Now, access enablers, three of them that we are really focusing on. The first is to strengthen the efficiencies around regulatory pathways. Yeah. The second is to work in forums like this to advance medical education and professional development of healthcare professionals, while the third access enabler is working with country authorities and stakeholders to strengthen supply chain logistic pathways. So, like you rightly noted, it goes beyond providing our innovative and, in fact, our full portfolio of medicines and vaccines. We are working along these three access enablers, working with the country authorities, country governments, as well as important stakeholders like the Society of Family Physicians of Ghana to advance medical education, to encourage and enhance professional development. In this case now, in this specific case of breast cancer care, because in Ghana, for example, the burden of breast cancer is significant. Over 4,000 women are said to die of breast cancer in a year in Ghana, right? And it is important to note that early detection early treatment saves lives. It improves or increases the prognosis of these women. So yes,